almost a year ago, told me about his idea for this symposium, and of course I was thrilled about it. And I said to him, "This is about the oral history. This is about all of the oral historians, all of whom have been fortunate enough to be privileged to play a role in a major historical event." And I consider myself very, very fortunate, very privileged. What I'm going to do in my 25 minutes is, first I'm going to tell you a little bit about me because I want to, because everyone else has, and I think I need to in order to explain some of the things that happen next. The next thing I'm going to do is to talk about an important piece of the history that no one has mentioned, which I find a little incredible, except for Fred in passing, and that's the CMD Special Committee on PTSD, which, and I will get to it in a moment, but really that committee was, in my mind, the equivalent of Irish monks in the 14th century copying down Aristotle so it wouldn't be lost. I really do think that in our own way, at least within the formal VA structure, whereas the Vet Center program was by design supposed to be outside of that for reasons that you've heard earlier, and for good reasons, I think it was the special committee that kept those few candles flickering until the National Center could be born. And I do believe that the parentage of the National Center is the special committee. So I'm going to tell you about it. And it's more important for me to tell you about that, frankly, than to tell you about the National Center. We'll talk a little bit about the National Center, and what I don't talk about, just grab me as you see me in the next couple of days. First, about me. I got into the VA system in 1973 to support my addiction to Vermont and New Hampshire. I would have taken any job that would have kept me in that truly extraordinary part of the world. It happened to be a VA job. I said, I'll do this for a year, and then I'll find something interesting to do. This is my 25-year pin, folks. Because every year has been interesting. Enjoyable, not necessarily, but interesting, absolutely. And two things were very important when I entered the VA system in 1973. One was that I had decided I really wanted to talk to the Vietnam veterans because my background was in drug abuse and substance abuse. I'd been at Lexington, Kentucky before I came to Dartmouth and to the Mass General, et cetera. And I figured that I would have to start a methadone maintenance program for what I was reading in the media, because all these guys were hooked on something, and et cetera. And I was going to do that because that was something I knew how to do. The second thing and so because of that, I went out of my way to talk to these, mostly men, and realized very quickly that there was something very important that they had to say that had nothing to do with alcohol, heroin, et cetera, et cetera. It had to do with what they'd seen, what they'd done, what they were still feeling, seeing, dreaming, et cetera. Second thing that happened to me just about the same time was I fell in love with a Vietnam veteran, who is my wife, Gail Smith, who was in Bentui, 1970-71. Her story is in everything we had. It's titled A Nurse with Round Eyes. And Gail and I started groups for vets. We had groups in our home for the guys that couldn't get past the bricks, and we had a group in the hospital. So I was starting to walk in a direction that wasn't my real interest, but it was important, and it began to consume me, and I became very interested. Also, because I was a pharmacologist turned psychiatrist, I was very interested in the neurobiological basis of all kinds of psychiatric disorders, so I got asked to talk about that perspective whenever something having to do with Vietnam vets came up, and I began to learn and realize for myself how incredibly complicated, fascinating, and fundamental were the kinds of problems. I wrote an article in the late 70s where the only biology at that time was the sleep studies, some of the sleep studies, some of the psychophys studies, etc. Another thing I've been doing, because I was in a rural area, was I was setting up rural healthcare delivery systems, and I was doing that. So when I heard about the vet centers, that there were going to be 5 pilot programs, and wasn't surprised that Little White River Junction wasn't on the list, I called up Washington and I said, "You got to put me on the list." I said, "I've been doing vets and I've been doing outreach," and we did have the first vet center. And we were told we couldn't make it official. I have witnesses, people were there, I was there, Rick Vietman was there, a lot of folks were there. And what was interesting also, and you've heard some of this from a number of different people from their perspectives, other perspectives, was I didn't know what else was going on. I was doing my thing in Vermont, and I was finding myself getting more and more involved in this thing. I didn't know about Fred Gussman. Terry expressed it earlier. I didn't know about Terry until in 1984 there was a piece of legislation that was passed, which was passed again, Bill Brew, Senator Cranston, because there was real concern, and you've heard a lot of the reasons about this concern, that VA wasn't doing all it should do for Vietnam veterans. And this was called the Chief Medical Director's Special Committee on PTSD. And it really was a bizarre, concept, because what was unique about the committee was that we reported directly to Congress, so that our reports couldn't be mothballed on someone's desk for 5 years before they saw the light of day. They had to get to Congress, which was an incredibly important factor, which we understood that very, very soon. But what was bizarre about it was the members of the committee had to be VA employees. So, the only analogy I could think of was sort of like in Stalinist Russia, being a Communist Party member and asked to inform on your family. And most of us didn't have much power in those days, and most of us were fortunately not afraid to take the risks that had to be taken. I mean, I was only going to be in the VA for a year. Here it was, I was already my 11th year by this time. But that was very, very important, I think, that this committee, and there are a number of Terry, Spencer Falcon, Joan Fury, Fred Gussman, Al Batras, Joe Gelsomino, and a few others. We were the dirty dozen, and we were proud of it. And we were sitting around, and we had to get, we were convened in late December, and we had to get a report to the committee by January 15th, remember? January. So I locked everybody in rooms in the VA for a week until the report was done, and it was done. And I remember we were sitting around the table, we finally had the report, and we said, we got to make recommendations. And Fred said, you can't make a recommendation that doesn't ask for money or no one's going to pay any attention. So the first recommendation we made, and he was right as usual, and the first recommendation we made was that there should be a PCT in every VA hospital in the country. That was our first recommendation. We're about 5,000 other recommendations, but that was our first, and it became prophetic. And again, thanks to the support that we had always from outside the VA. And that hasn't changed, folks. It hasn't changed. The support that we continue to rely on is from the veterans organizations, the people in the Congress that have vision, that understand what's going on. Support is not in VA. We have 2 eminent graduates of our committee who are in VA, Joan Fury, Al Batras, but by and large, that's all she wrote. So we did 2 things I think that they didn't expect us to do in the special committee. And I'll try to wrap this up quickly so I can talk about the National Center for a minute. I think what they had anticipated was what we would produce would be a series of shrill rhetorical pronouncements that could be easily dismissed. We didn't do that. We had 2 rules that guided everything we did. The first rule was that PTSD is one of the few things that VA should be doing And that's what VA was created for. It is the service-connected disability in psychiatric circles. It's more important than schizophrenia, it's more important than depression, it's more important than most cancers, than heart disease, etc. That was our first in-your-face. The second thing we did was what's the Orson Welles, selling the wine before sun. Every statement that we made in our reports was data-driven. And we went out and we got data. We got data on disability benefits showing how erratic it was from one place to the other. We got data on inpatient admissions showing that unless you were going to assume that there was something about the water in Ohio that was different than the water in North Carolina to explain that there were 10 times more PTSD cases in Ohio than in North Carolina, you can only explain it by lack of quality control, lack of understanding of PTSD in the VA system. And that data, I believe, plus all of the tremendous support that had been generated that you've heard about from Charles Figley, John Will, all the other speakers, and also from the NVVRS, which came a little while after we were in business, but it was a major boost. Got the kind of attention that it deserved from the Congress. And what Fred has showed you as being dismantled was created. New dollars were brought into VA to create PTSD programs, outpatient, inpatient, etc. And I do believe, I realize this is self-serving, and I hardly claim to be a neutral historian in this regard, but I think when you talk about the history, you have to talk about the CMD Special Committee. And we were fearless, and we enjoyed being fearless, and because what we did, we felt really mattered. Well, it was through the committee that two things happened for me. One was that the committee gave me, and I think all of us on the committee, a national vision of PTSD, of systems, of how you need to solve or try to solve a problem on a national level. You know, and it wasn't the kind of stuff I learned in medical school. It wasn't the kind of stuff I was going to learn in Little White River Junction, Vermont. But it was very important, and it was for me at least, and I think for others, in the crucible of working on that committee, that we evolved a collective vision of what a National Center for Post-Traumatic Stress Disorder should be. Now, just to tell you about the legislation, which was interesting, and as I look back, I think it was brilliant. Even though our National Center is different than the National Center in Australia, than some of the other national centers that other nations are trying to create, because we were by congressional mandate not a clinical operation. We were by congressional mandate research and education. That was what we were supposed to do, and it was our job to figure out how to get what we did, make it, package it, disseminate it so that it could be useful to help veterans, to help the clinicians that were trying to treat the vets, et cetera. I'm getting a little ahead of myself here. And we felt, looking at the congressional mandate, which basically said that a National Center for Post-Traumatic Stress Disorder, should be in the forefront of the latest research on post-traumatic stress disorder, and the forefront of the education and disseminating information and collecting that information. And there already had been a national center, which didn't work out, and for a lot of reasons. We felt that no single place in the VA could fulfill this mandate. So 5 of us got together and essentially created a multi-specialty consortium based on the strengths that were inherent at the specific places where they were. So that Terry bringing all the strengths of the psychological know-how at Boston, Fred with the biggest PTSD program in the world and all of his experience that went with that. Dennis Charney and his magnificent psychobiological capability at Yale Medical School and the West Haven VA. and up in White River, Dartmouth being at the forefront of information services, the Baker Library group being, major information dissemination where we put our resource center, and we had programmatically linked to us Bob Rosenheck because he was doing all of the evaluations on the in and outpatient programs, and we felt that was our network to all the clinical people that were out there, and we could use that network as a bridge to all of the clinicians. We had and VA bought into this. They bought into this concept, this vision. They're building this multi-practice. I'm told nowadays that what we have created is very fashionable. We created a virtual center, is what it's called. And we had one of the arguments was, well, Friedman, how the hell do you think you're going to run something like this from Vermont? And I said, what difference does it make if I'm in Vermont or in Washington, D.C.? With computers, with email, with faxes, it doesn't matter where I'm located as long as I can access all the people that I need to access. And they bought the argument, fortunately, because I wasn't going to leave Vermont. So I had my cake and I've been able to eat it too. I'm a very lucky man. We had two other divisions. We had the first child of the National Center was our women's division, run by Jessica Wolf. Jessica was originally working in Terry's shop as the sensitivity of VA and the concern and the attention and additional resources on problems of women, veterans, and of course at the same time the Vet Center program was developing its special focus on the problems of women veterans. We worked with RCS on that. So that was the next, and then finally Ray Sturfield out in Hawaii. We had the Pacific Islands Division, and that's the National Center. I've got maybe 9 minutes. I want to tell you just a little bit about where we are and where we want to go. Where we are is I think we've really had a major impact on the research agenda on PTSD international. I don't think there's any question about that. I was in Canada 2 weeks ago. The Canadians use their assessment battery, or all the scales that Terry's developed, plus the MMPI too, but what are you going to do, right? I think that PTSD, when I started in this business, there really was this mind-body duality about PTSD. It was a psychological problem. I don't think there's any question now that there is dysregulation of major brain systems. My own understanding of this is that what PTSD is about are all of the systems that have evolved through evolution for the survival of the species. So it's bloody complicated. So it doesn't surprise me that we haven't found a magic bullet, a penicillin for PTSD yet. But the good news is that drug companies are now developing new kinds of drugs because of the psychobiological insights that we've been able, along with others, been able to create, so that instead of dusting off antidepressants and saying, here, PTSD patient, you take it and try to get better, we're now developing drugs that are specifically, might be expected to work in PTSD. I think we've done a lot of things. To me, I think that I just want to emphasize the three major areas that I as long as I'm at the helm, I want to take the National Center, and I hope the VA will let us do this. One is working with the Department of Defense, working with the veterans of tomorrow. And I got to tell you, folks, it hasn't been easy. It has not been easy. The door was open a little bit during the preparations for Desert Storm when DOD needed us. And 70, you all know this, 70 VA hospitals were made available for fresh casualties from the Gulf because the military bed capacity would have been easily overwhelmed. So we started working with DOD, but as soon as President Bush brought the men and women back, that door was not open very much anymore. But in the intervening years, we have some wonderful collaborations with DOD, working with female recruits at Parris Island, working with men in basic training at Fort Bragg, looking at the psychobiology, and on and on. And what our vision is number one, to have a programmatic relationship with DOD so that we can begin to identify people that are having a hard time while they're still in uniform, be able to do the kind of intervention. So hopefully by the time the veterans, whatever problem might have developed, we will have, if not eliminated, at least minimized. And that information follow them into veterans. That's my number one priority. Number two priority is working with primary care practitioners, since most people with PTSD do not seek mental health treatment. They seek treatment from primary and specialty medical care providers. And we've been developing a variety of screening instruments that can be given along with a smoking history, a drinking history in a primary care setting. And that's a second major initiative. Third, and here Fred has been leading us, is working with the medical disaster response system. Our job is training, and we developed a manual for training, and Fred has, we were doing training all over VA. We have now partnerships with Red Cross, with FEMA, with Public Health Service, and to begin to programmatically hardwire that. While we're doing that, to continue all of, I think, the extraordinary research and that we're doing. Our pilots database is the biggest database in the world. It's available to anybody that can access our website. People download it in remote Africa, in parts of Asia. They have the titles, now they want the articles, and that's another problem. And we've been, and the other thing is working with new technology. I think the website, etc. One little anecdote, and then well, I've got plenty of time. I'll keep talking. No, I'm done. I'm done. Okay. I knew that.
It's a great story.
Okay. So anyway, that's a 15-cent tour through the National Center. That's where we want to go. I think I told you a little bit about how we got there. It's a part of the history that most people don't know about, but it was a major part of my life from 1984, and I'm just very, very joyful that I had a chance to be there at that time. Thanks a lot.